1.5 million Americans suffering from addiction, and the fact that less than 350,000 were in treatment and don't get effective treatment. Of the 20% who do get effective treatment, many aren't getting the 3 drugs that we know that work: methadone, Suboxone, and naltrexone. This needs to change. Dr. Collins also talked about some groundbreaking stuff, which when I talked to Dr. Baker this morning, I get a little bit more enlightened on. That we know Suboxone, one of the big risks, whether it be at the jail, whether it be in different places where it can be used. It can be abused. And as I heard a speaker last night say, you don't send someone home, a heroin addict home with 90 Suboxone tablets. You know, they're going to fail. But they now have extended release Suboxone that they can put in the blood, put in your body. Dr. Baker's been authorized to administer it. I didn't know this. And it will last for 6 months. 6 months, think about that. 6 months of having that in your system and counseling, you're 6 months into recovery. They talked about some other groundbreaking stuff. They called it, space-age science. Immunotherapies, when put into the body, they will also restrict and prohibit opioids from actually reaching the brain. What the NIH is doing on this is just incredible. They've talked about another $500 million in funding they got. But it wasn't all about the NIH. There were small victories as well for people on different levels. People breaking down the silos, people working collaboratively. For example, in Kentucky, where they've been very hard hit, in Congressman Hal Rogers' district, they went to all the new home builders and got all the new home builders to agree that they would all put at least one locked medicine cabinet in the new homes that will be built. These are the small things, but then you talk about the bigger things, the stigma. Letting people know, advancing the fact that this is a chronic disease of the brain, it's not a moral failing. That we have to have compassion, and more compassion in this way. Sometimes compassion gets me into trouble. I don't care. We are going to do the right thing. We're not going to publicly condemn people because they have the disease. We've got to erase these biases. We've got to steer people towards treatment. Overdose now is the leading cause of death for Americans under 50. The Centers for Disease Control and Prevention reports 64,000 people dying in 2016. At the conference, they said between June 16 to June 17 is 67,000. We know this is the same number that died from vehicle crashes, firearms, more than the number of those that died in Vietnam. And what's an incredible statistic is the fact, and I'm speaking too long, I'm going to end real quick, is that life expectancy has actually gone down in the United States because of this. 2,000 people died from overdoses in 2017 in Massachusetts. And now more than ever, people know someone either with an addiction or know a family that has lost someone. In 2016, as we get the tox screens back, we found that just about 2 people die every 3 days in Worcester County. It's not a rich problem, it's not a poor problem, it's not a black problem or a white problem, it's everyone's problem. And the message is getting out there. This isn't the dredges of the earth who suffer from this. These are your neighbor's kids. Vivek Murphy, Surgeon General Vivek Murphy, as former Surgeon General said, and I think he's done some groundbreaking stuff on this. This is a moral test for America. Are we a nation willing to take on an epidemic that is causing great human suffering and economic loss? Are we able to live up to that most fundamental obligation we have as human beings to care for one another? Well, what have we done here? We, not I, we, formed the Central Mass Opioid Task Force 3 years ago. And as you can see, we're making progress. We have over 300 people. 300 wonderful people who care about the fight. 300 wonderful people who are bringing the message out, who will help removing the stigma, help removing the bias. I got some great office staff, Liz Haddad, Jillian Woolbridge. We've gotten over $500,000 in grants to provide Narcan, to get drop boxes, to bring the program. It's not about drugs, an evidence-based program to the middle schools. The forums, bringing Sam Canones, the author of Dreamland here. The buyback, the program we have in Pittsburgh with Chief Marshall, the buyback program we have in Worcester with Chief Sergeant. The latest is the Leominster Court, Leominster Gardner areas, where we're actually started a diversion program for the first time in Worcester County. Come in, accept treatment, we'll get you to treatment, you're not getting charged. Liz Haddad runs one of our, and Liz and Jillian run our Hidden in Plain Sight. displays, our memorial wall, which says it all. Let you know it is our sons and our daughters, our friends, our brothers and sisters. How does it translate to what we do in court? We tell our assistant district attorneys to show compassion but stay within the law.